New question, the member from Algoma, Manitoulin.
Thank you, Mr. Speaker. My question is to the Minister of Health and Long-Term Care. Minister, May is Lyme Disease Awareness Month, and a time to remember the thousands of Canadians who are affected or suffering with Lyme disease. The 2015 tick season has begun, and doctors and veterinarians have already begun removing ticks from people and animals across the province. We are going on 6 months since my motion calling for a provincial strategy for Lyme disease passed unanimously in the House. Can the Minister please provide me, with all our guests, with an update on your progress with this Lyme prevention strategy?
Minister of Health, Long-Term Care.
Thank you, Mr. Speaker. I appreciate the question from the member opposite. And I should start by saying that we've launched an action plan which covers virtually every aspect of this important disease. And I know the third party, despite what the opposition, their denials, I know the third party agrees that with climate change and increasing temperatures, it actually is becoming worse. It's more serious. It's more pressing. That doesn't take away from the urgency to deal with this appropriately. And Public Health Ontario is reviewing and updating our 2012 technical report on Lyme disease prevention and control. I mentioned that our action plan already underway includes a review of the testing, the diagnosis, the treatment protocols based on the best evidence available. In the United States, the Infectious Disease Society of America, the American College of Rheumatology, the Academy of Neurology are currently working on new guidelines that will inform our work as well. But most importantly, and I appreciate the fact that the stakeholders, the advocates are here today, I will continue to meet with them and benefit from their advice and their expertise to guide us on developing this new strategy.
Supplementary.
Minister, again to the Minister, a critical component in the development of Ontario's Lyme strategy is the consultation with the stakeholders named in the motion, all of whom have joined us here today. If the stakeholders that will speak for patients are not consulted, we will get absolutely no changes made to Lyme education, testing and treatment, and patients will continue to suffer. The clock is ticking, Minister. When will these stakeholders be called together and consulted in order to develop Ontario's Lyme disease strategy? You've had almost 6 months. Look around, Minister. Do you see all the people your so-called to action plan has taken no action? These people have traveled great distances to having their voices heard. Minister, how much longer do these people have to suffer until we finally take actions on Lyme disease?
Please. Thank you. Minister.
Well, Mr. Speaker, the member opposite knows very well that this, and he's not portraying it as this at all. This is a nonpartisan issue. And I want to speak to the individuals, the stakeholders, the advocates, those that suffer from Lyme disease that are here with us today. And I appreciate the seriousness of this disease, and I commit to working with you now and going forward. It was specific to my request that I asked Public Health Ontario to develop a standalone Lyme disease stakeholder group to work with us on an ongoing basis as we develop this strategy, and I intend to make sure that we constantly and on an ongoing basis are benefiting from your advice. This is an extremely difficult issue, and I appreciate more than anything else the pain and suffering that many of these individuals have to endure. And I know as well that they feel that the government and the primary care providers haven't necessarily been there to the degree that they should have been at that difficult moment in time. I commit to them to working with them to develop a strategy that